This medication is administered through an injection under the skin by a healthcare professional. Your doctor will provide specific instructions on where to inject, typically in the abdomen, and it is usually given once a week for 4 weeks. After each injection, a healthcare professional will monitor you for at least 30 minutes to check for any allergic reactions. The frequency of additional treatment cycles will depend on your medical condition and how you respond to the treatment. If your condition does not improve or worsens, be sure to inform your doctor. If you experience headache or injection site reactions such as redness, pain, bruising, itching, or swelling, it's important to notify your doctor or pharmacist. It's important to remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the risk of potential side effects. While many people using this medication do not experience serious side effects, it's important to be aware that it may lower your ability to fight infections, making you more susceptible to serious infections or worsening any existing infections. If you notice any signs of infection, such as a sore throat that doesn't go away, fever, chills, cough, or painful/burning urination, it's important to seek medical attention. While a serious allergic reaction to this drug is rare, it's crucial to seek immediate medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. If you experience any other effects not listed here, make sure to contact your doctor or pharmacist. Before using this medication, it's important to let your doctor or pharmacist know if you have any allergies to Efgartigimod Alfa or hyaluronidase, as this product may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have a current or recent infection. Efgartigimod Alfa may increase your risk of getting infections or worsen current infections, so it's best to avoid contact with anyone who has a contagious infection. If you have been exposed to an infection or have any concerns, it's important to talk to your doctor for more information. Before receiving any immunizations or vaccinations, make sure to inform your healthcare professional that you are using this product. It's also recommended to avoid contact with individuals who have recently received live vaccines. Prior to undergoing any surgical procedures, be sure to inform your doctor or dentist about all the medications you are using, including prescription drugs, over-the-counter drugs, and herbal products. If you are pregnant, it's important to discuss the risks and benefits of using this medication with your doctor. Additionally, mothers who have used this medication during pregnancy should consult a doctor about immunizations for their newborn babies. It is not known whether this drug passes into breast milk, so it's essential to consult your doctor before breastfeeding. When taking Efgartigimod Alfa 1008 Mg-Hyaluron-Qvfc 11,200 unit/5.6 ml Subcut Soln, it's important to be aware of potential drug interactions that could affect how this medication works or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. Before making any changes to your medication dosage, always seek approval from your doctor. It's crucial to follow their guidance and not start, stop, or change the dosage of any medicines without their approval. This will help ensure the safe and effective use of Efgartigimod Alfa 1008 Mg-Hyaluron-Qvfc 11,200 unit/5.6 ml Subcut Soln. If someone has taken too much Efgartigimod Alfa 1008 Mg-Hyaluron-Qvfc 11,200 unit/5.6 ml Subcut Soln and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. You can call 911 in the US or your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. It's crucial to act quickly in these situations to ensure the person receives the necessary help. Make sure to follow up with your doctor for any necessary lab tests, such as a complete blood count. It's important to keep all of your medical and lab appointments to ensure that you are using this medication safely and effectively. Your doctor can provide you with more information on what tests are needed and when you should schedule them. Make sure to take each dose of Efgartigimod Alfa 1008 Mg-Hyaluron-Qvfc 11,200 unit/5.6 ml Subcut Soln as prescribed by your doctor. If you happen to miss a dose, be sure to consult with your doctor or pharmacist to determine a new dosing schedule. This medication is crucial in helping to manage certain medical conditions, so it's essential to stay consistent with your dosing. This medication, Efgartigimod Alfa 1008 Mg-Hyaluron-Qvfc 11200 unit/5.6 ml Subcut Soln, is typically administered in a clinical setting and is not meant to be stored at home. It is used to treat certain types of neuromuscular disorders. Your healthcare provider will determine the appropriate dosage and schedule for your specific condition. It is important to follow their instructions and not to store or administer this medication at home. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.